Welcome to our virtual joint replacement class. We're excited that you have chosen UP Health System Marquette for your upcoming hip or knee surgery. Our total joint class began in 2011 to promote a successful surgical experience. Patients who attended this class have better outcomes such as less infections, less emergency room visits, and readmissions to the hospital within 90 days of surgery. We are part of the Michigan Arthroplasty Registry Collaborative Quality Initiative, which is also called Marquette. This is a group of orthopedic surgeons and medical professionals dedicated to improving the quality of care for patients undergoing hip and knee replacement procedures in Michigan. Patient information such as smoking history, height, weight, preoperative exercises, medications, lab results, and preoperative skin cleansing are entered into a statewide database to improve care for future patients. Also, surgeons' operative approach, implant devices, and opioid prescriptions are submitted. Data is collected from before surgery through 90 days post-op. Patient surveys are collected to get your point of view on your well-being and functional health before surgery, within 3 months, 1 year, 2 years, 5 years, and 10 years after surgery. The goals for Marquette are to improve patient safety in Michigan by promoting better outcomes, enabling surgeons and hospitals across the state to work together to improve quality and to make Michigan the best place in the world to have a joint replacement by reducing blood clots, reducing infections, reducing readmissions and ER visits, reducing discharges to nursing homes, and reducing the narcotic use. Your surgeon chooses the best implant for you based on many factors, some including your anatomy, weight, age, activity level, general health, and the performance record of the implant. It is essential for you to identify a friend or family member to be your primary support, your coach. Coaches are invited and encouraged to participate in all parts of the program and be your second set of eyes, ears, and hands throughout your joint replacement journey. They can assist you with a smooth transition from the hospital to home and will assist you with physical and emotional comfort, which is key to your healing.
Infection prevention. Although rare, infections are a risk of any surgical procedure. Our goal is to minimize your risk. You, as a patient, play a large role in your outcome after surgery. Some infection prevention tips: don't let any pets or animals lick your surgical incision site. Make sure to wash your hands often and prior to touching your incision. Do not schedule any elective procedures for at least 3 months following your surgery. This includes dental cleanings and dental work. Emergency procedures are okay. UPHS Marquette does everything possible to help prevent infections after surgery. Signs and symptoms of an infection may include a temperature of 101 degrees or more for greater than 24 hours, increased redness, warmth, or swelling around the incision, foul-smelling drainage, increased pain or stiffness, chills and or night sweats. If you have any of these symptoms, you're going to want to reach out to your provider. Prior to surgery, a nasal swab will be taken from your nose during your lab tests. This will tell us if either of these bacteria live on your skin. 30% of all people naturally have one of these bacteria. There is nothing wrong with you if your test is positive. It lets us know how to properly tailor your treatment during your hospital stay and prior to surgery. Every patient will get a nasal treatment called 3M iodine, applied to the inside of the nose about 1 hour prior to your surgery time. Treatment of the swab lasts about 8 hours. It helps prevent the bacteria from traveling from your nose to your incision during surgery. Please inform your doctor if you are allergic to iodine. If you are allergic, your surgeon will prescribe a different medication called mupirocin. Every patient with a positive MRSA nasal swab will also have an additional antibiotic called vancomycin given prior to surgery.
Preoperative prep program. The purpose of the preoperative prep program is to provide you with the education and materials designed to optimize your healing and reduce your risk of postoperative infections. You will receive a pre-operative prep pack from the Advanced Center for Orthopedics and Plastic Surgery Clinic, which will include chlorhexidine wipes, CHG oral rinse, toothbrush and applicator swab, and pre-surgery carbohydrate drinks. You will receive 2 drinks if you are not diabetic and 1 drink if you are diabetic.
Cleaning the skin before surgery can lower the risk of infection at the surgical site. The following will tell you how to use the cloths that have a rinse-free 2% chlorhexidine gluconate or CHG soap on them. Please follow the steps carefully during the night before your surgery. Cleaning your skin before surgery, do not shave any part of the body at least 2 days before surgery. Shower or bathe and shampoo your hair with regular soap and shampoo before you use the chlorhexidine cloths to clean your skin. Be sure your skin is completely dry and cool. It is best to wait 1 hour after showering to use the cloths. Clean your skin with the chlorhexidine cloths the night before surgery at your home. Do not rinse off the chlorhexidine. Chlorhexidine may cause your skin to itch or get red for a short time. If you have itching or redness that does not go away, rinse the areas and stop using the chlorhexidine cloths. Notify hospital staff upon your arrival to the hospital on the day of surgery. Do not shower the morning of your surgery. To clean the skin before surgery, open the package. You will find 6 cloths inside the package. Both sides of each cloth should not be used. Do not use the chlorhexidine wipes on your face or genitals. Wipe your body in a back and forth motion gently using all 6 cloths. Use each cloth for 30 seconds. Allow the area to air dry for 1 minute and do not rinse. Again, it is normal for the skin to have a sticky feel for a few minutes after you use the cloths. This is due to the moisturizer in the cloths. Throw away the wipes in the garbage and do not flush them down the toilet. Dress in clean clothes at night, sleep on freshly laundered sheets, and wear clean clothes the morning of your surgery. You're going to use cloth 1 to wipe your neck, chest, and abdomen. Cloth 2, you're going to wipe both arms, starting each with the shoulder and ending at fingertips. Be sure to wipe the armpit areas. With cloth 3, wipe your right and left hip, followed by your groin. Be sure to wipe the folds in the groin area. Cloth 4, wipe both legs starting at the thigh and ending at the toes. Be sure to thoroughly wipe behind your knees. Cloth 5, wipe your back starting at the base of your neck to your waistline. You may need assistance to reach all areas. Cloth 6, wipe your outer buttocks, but not the rectal area. Oral care before surgery. Hold clear side of package in one hand and peel back package to expose contents. Set package down with opening at the top. Remove the bottle of oral rinse. Open the oral rinse and pour half of the liquid in divot of packaging with toothbrush head and swab sponge still inside. Remove toothbrush. Make sure toothbrush head is wet with oral rinse and then brush teeth thoroughly. Spit saliva and extra solution. Do not swallow the solution. Once finished, throw toothbrush away in the trash. Remove oral swab, making sure that it is wet with oral rinse. Use the oral swab to brush entire mouth, including cheeks, gums, tongue, and roof of mouth. Spit saliva and extra solution. Do not swallow the solution. Throw the oral swab away in the trash. Use the remaining solution in bottle to swish around in your mouth and spit it out. Again, do not swallow the solution. Throw empty bottle and packaging away in the trash.
Pre-admission testing, also known as PAT. The PAT nurse will call you a few days prior to your surgery date. If you prefer to talk to a nurse in person, PAT is located on the first floor of the hospital by the emergency department. The phone number is 906-449-3100. During this visit or call, a PAT nurse will obtain your medical history and current medications, review tests such as labs, EKG, x-rays, and results needed prior to your surgery. They will also order any additional tests that are necessary and provide preoperative education. This is very important for your safety during your hospital stay. Eating and drinking before surgery. The evening before surgery, drink your pre-surgery carbohydrate drink provided in your preoperative prep pack. If you are not diabetic, repeat the second additional carbohydrate drink on the morning of your surgery, 2 hours prior to your arrival time. Do not eat anything after midnight. You may continue to drink clear liquids up to 2 hours prior to your arrival time. Some clear liquid options would be water, apple juice, Gatorade, Powerade, vitamin water, tea, black coffee, but absolutely no cream or milk in it, and soda. Diabetics should consider drinking the zero or low sugar options of these items listed. You'll find these options on page 12 of your Guide to Surgery book. You should consume nothing red in color. Do not consume any milk products or orange juice the morning of your surgery. Prior to arrival, please do not wear any makeup or jewelry, including your wedding band. No fingernail or toenail polish. Medications should be taken as instructed with sip of water, and do not shave your legs for at least 2 days. You may brush your teeth. Hospital arrival. Please arrive on time. This is the arrival time and not your surgery time. Check in at Central Registration Desk on the first floor of the hospital. After registration, you will need to check into surgical and procedural services on the second floor. Take the patient and visitor elevators located behind the information desk at the main entrance and check in with the volunteer at the desk. Hospital arrival. Pre-admission assessment. The nurse will review your history and medication list. Vital signs and physical assessment will be included with that. You will also use chlorhexidine wipes and a mouth rinse, and you will be treated with the 3M povidone iodine nasal treatment if needed. You'll put on a clean gown and a warming gown. You will empty your bladder, and the nurse will start your IV. The surgeon will mark your surgical site, and you will talk to the anesthesiologist about the types of anesthesia. Your CRNA will monitor you during the procedure, and your circulating nurse, the RN, will advocate for you. Please tell the nurse of any concerns you might have. If you have a bad shoulder and need special precautions with positioning, or if you get nauseated with anesthesia, please let them know those concerns or anything else you feel is important. There are different types of anesthesia. A spinal anesthetic is a medication given through a small needle in your spine to numb the nerves from your waist down. You will not be able to move or feel your legs until the medication begins to wear off. This is a preferred method of anesthesia because it allows for better pain management and there's less risk of post-operative. General anesthesia is another type of anesthesia often used. Medication is given through an IV to put you to sleep. A tube is placed into your mouth and down your windpipe to help breathing. This works on the brain as well as the rest of your body. You often will not remember the surgery or the time right after. Also used is a periarticular injection called a local or pain cocktail. It includes a mixture of medications called Neuropin, Toradol, lidocaine, morphine, and epinephrine. These medications are placed in the tissue surrounding your joint during surgery and typically last 12 to 24 hours. The adductor canal nerve block is another type of anesthesia that can be used. This is done only for the knee replacements and includes these medications, Neuropin and Marquette. It results in pain relief and possible numbness, and you should not experience any weakness with this. And this typically lasts 12 to 18 hours. When you go to the operating room, you'll be brought on a stretcher into the OR by the CRNA, or the nurse anesthetist. Your surgery team will include a surgeon, physician's assistant or nurse practitioner, 2 surgical techs, a circulating RN, and the anesthesiologist and the CRNA. After surgery, the surgeon will speak with family in the waiting room or contact family by phone during precautions. You will be brought into the post-anesthesia care unit, also known as a PACU, on a post-operative bed. 1 nurse will be caring for you and another patient. Expect to stay at least 1 hour or more to recover. After recovery, if you're going home the same day, you'll be brought back to the prep and recovery area. If you're staying the night, you will be brought to your room on the 7th floor. While you are in the hospital, you'll receive an incentive spirometer to help keep your lungs clean and active through the recovery process. This is a device that measures how deeply you can inhale or breathe in. It helps you take slow, deep breaths to expand and fill your lungs with air. When you are active, you take frequent deep breaths throughout the day. Spending more time lying in bed decreases the depth of your breathing. When you take shallow breaths, you do not move air into your lung bases. This can allow fluid to sit in your lung and put you at risk for pneumonia. If you have a history of smoking, pneumonia, or chronic lung disease, you are at a greater risk. So how do I use an incentive spirometer? Sit up as straight as possible. Do not bend your head forward or backward. Hold the incentive spirometer in an upright position. Place a target pointer to the level that you need to reach. Exhale or breathe out normally, and then do the following. 1. Put the mouthpiece in your mouth and close your lips tightly around it. Do not block the mouthpiece with your tongue. 2. Inhale slowly and deeply through the mouthpiece to raise the indicator. Try to make the indicator rise to the level of the goal marker. 3. When you cannot inhale any longer, remove the mouthpiece and hold your breath for at least 3 seconds. 4. Exhale normally. 5. Repeat these steps 10 to 12 times every hour when you are awake. One easy way to remember this is to use your incentive spirometer every time a commercial break comes on the TV, before lunch, after therapy goals are met.
Physical therapy. During your stay in the hospital, a physical therapist will teach you how to get out of bed, standing and walking, how to climb stairs, and exercise training and your home exercise program. Occupational therapist. During your hospital stay, the occupational therapist will help you complete self-cares, including bathing, getting to the bathroom, and how to get dressed. Some safety techniques that can be used for your home, as well as adaptive equipment that you might need. Some home equipment that you may need after your surgery. A walker, a 2-wheeled walker is preferred, toilet riser, shower chair or tub bench, reacher, sock aid, and long shoe horn. Your physical therapist and occupational therapist will help make recommendations on what equipment you will need based off of your individual needs. On the next slide, you will see a video on how to use the adaptive equipment. 2 pieces of equipment that you will most likely be given is a reacher and a sock aid. A reacher can help put on your pants without bending over, because oftentimes with a posterior hip precaution, you are not allowed to bend past 90 degrees to help get dressed. The other piece of equipment that you might be given is a sock aid, which helps to put on your socks, again, if you're not able to bend to reach and put on your socks. This is a similar one that we often give at the hospital, where the gray side is the bottom of where you want the sock to go on. You're gonna pull the sock over the ends. Essentially what it does is it holds the sock open. Next, you are going to put the sock aid on the floor. Your foot is gonna slide into the sock aid, and you are gonna pull up on the strings, making it easier to put your socks on. Tips to prepare your home. Use a first floor bedroom whenever possible. Remove cords, throw rugs, and clutter away from walkways. And keep frequently used items at the waist to shoulder level when possible.
Your protein intake after surgery will be a key component of the healing process. Protein helps you maintain your lean muscle mass. It is also important for helping your incision heal, as it is a key ingredient in new tissue. Protein also plays a role with helping keep your immune system strong. Protein makes up the cells of your muscles, blood, and skin. By building new tissue, it helps heal wounds. Good quality sources of protein include lean meats, seafood and fish, eggs, dairy products, soy, and quinoa. Nuts and beans also include protein, though are considered a lower quality protein. When planning what to eat after your surgery, plan to include a protein source with every meal and snack for adequate healing. To aid the healing process after surgery, plan to eat a balanced diet. A healthy diet after surgery will help support healing and help reduce inflammation. A balanced diet should include plenty of whole grains. Whole grains are good sources of the B vitamins and healthy carbohydrates, which help metabolism and brain function. It should also include plenty of fruits and vegetables, which are an important source of key vitamins, minerals, and fiber, which can help repair muscles, bones, and cartilage, and also aid with bowel regularity. A balanced diet will also include low-fat dairy, which is a good source of calcium and vitamin D. Please try to limit refined sugar, also known as added sugar, alcohol, and caffeine. Too much of these foods can dehydrate you and cause inflammation, which can increase your risk of infection. The picture seen here is known as the MyPlate. The MyPlate is a useful tool for meal planning. Designing your plate to look like the one shown here will help ensure you receive adequate serving and portion sizes of the different food groups. Notice half the plate is fruits and vegetables. A quarter of the plate is a grain source, and whole grains are even better. A quarter of the plate should be a lean protein source, and then also include a low-fat dairy serving to round out the meal. There are many resources for using the MyPlate for meal planning at choosemyplate.gov. Things to consider after your surgery. When you are in the hospital after surgery, plan to start with a simple meal to ensure your stomach is ready to reintroduce food. You will start with clear liquids, such as jello or broth. Progress to full liquids, such as a smooth yogurt or soup, and then back to regular textured foods as your body is ready. Please follow your physical therapist's recommendations to the best of your ability. Mobility will help prevent fluid overload and promote bowel function. Consider taking a stool softener. Both pain medications and anesthesia can slow your GI tract movement and cause constipation. Being sure to include good fiber sources and adequate hydration will also help prevent constipation. After surgery, your appetite may be affected by medication, the surgery itself, anesthesia, and/or fatigue. Plan to take your pain medication with food to prevent nausea. If you feel you are not eating well or otherwise unable to eat a balanced diet, an over-the-counter multivitamin may be beneficial for you during this time. Plan to drink 6 to 8 cups of fluid each day to prevent dehydration, unless your doctor has specified another daily amount of fluid for you. Generally, having clear urine is a good sign of adequate hydration. Easy ways to meet your nutrition needs. Plan to eat small, frequent meals or planning snacks for between your meals. Try to eat every 3 to 4 hours upon waking for energy, healing, and better physical therapy performance. Consider trying a protein or nutritional drink if needed. Freeze homemade meals beforehand so you have a quick, easy meal afterwards. Or consider healthier frozen meals with at least 300 to 400 calories and 20 to 30 grams of protein. If you should have questions about your nutritional status, please contact the Nutrition and Wellness Diabetes Education Department. Phone number 906-449-3460 during normal business hours Monday through Friday, 8 a.m. to 4:30 p.m. Or, while you are in the hospital, just ask your nurse for a dietitian consult.
Hospital discharge and caring for yourself at home. Prior to discharge, you will have discharge goals that will include being able to walk 100 to 150 feet with a walker. Must be able to go up and down at least 3 steps using a handrail. And you must be able to move from different positions with an assistive device by yourself or with help from your caregiver. An example is moving from sitting to standing or lying to sitting. Prior to your discharge, make sure you understand your doctor's instructions, what medications you should take and how often to take them, what your bathing instructions are, incision care and keeping incision area clean, activity levels and any limitations, your follow-up appointments, and when to call your physician with concerns. Advanced Center for Orthopedics has a provider on call 24 hours a day. Your dressing will be placed in the operating room. The dressing will contain a silver lining to help prevent infection. It is waterproof. If the edges peel up or drainage reaches the edge, the dressing will need to be replaced. The dressing will be removed at your 2-week follow-up appointment. Home health services may be ordered by your doctor upon discharge from the hospital. A registered nurse and/or a physical therapist will evaluate and develop a plan of care together with your doctor. Typically, home health services are needed for only a short time after surgery, on average 2 weeks. You may be able to go directly into outpatient therapy without home health. Common home health services include orthopedic surgical aftercare, home physical therapy to assess your strength and mobility and to initiate exercise programs to meet your physical goals, vital sign monitoring, pain control monitoring, and assessments of other medical conditions you may have. What is a blood clot? Your blood cells stick together or clot to help you stop bleeding when there is an injury to one of your blood vessels, such as a cut or a scrape. Sometimes this occurs in your body without an injury to your blood vessel and can cause health problems or even death. If a clot forms in one of your major deep veins, it is called a deep vein thrombus or DVT. A DVT most often occurs in the lower legs or thighs. If a clot forms or moves to your lungs, it is called a pulmonary embolus or PE. A PE is the most serious form of a blood clot. Signs and symptoms of a DVT or deep vein thrombus include swelling and/or redness in one or both legs, and sometimes can be warm. Pain in your legs, most often calf area, can feel like a cramping or a soreness. Call the orthopedic office if you experience any of these symptoms. Symptoms of a PE or pulmonary embolism are unexplained sudden onset of shortness of breath, chest pain or discomfort, feeling lightheaded, dizzy, or fainting, feeling like you have a rapid pulse, or coughing up blood. Go to the nearest emergency department if you experience these symptoms. To prevent blood clots, you're going to want to walk and move frequently. You also want to do foot pumps while laying down. You'll wear sequential compression devices or SCDs, and you may be prescribed aspirin therapy. Anyone that can't take aspirin will take another medication such as Xarelto, Coumadin, or Lovenox. Pain management. While in the hospital, we do everything we can to keep your pain at a tolerable level. Hospital staff will ask you to rate your pain on a scale from 0 to 10. The goal is to maintain your pain at a level of 4 or less. Most patients will be prescribed Tylenol every 8 hours for the first 2 weeks after surgery. Do not expect to be pain-free. Tolerable is the goal. Pain will lessen over time and quickly over the first few days following surgery. Some tips to manage your pain at home include walking and moving frequently. Icing your knee or hip can help reduce pain and swelling. You may use the Polar Care device, frozen vegetable bags, or ice packs. Pain medication. Make sure you take your prescribed Tylenol around the clock every 8 hours. Only use narcotic pain medication when needed. Start weaning your narcotic pain medication as soon as you are able. It is expected that you would be off of narcotic pain medications by day 5. Relaxation techniques can also help manage your pain. Comforting scents such as lavender or sandalwood. Managing your pain will allow you to heal faster. Hydration and bowel care. The decreased activity or exercise, use of narcotic pain medication, and changes in your diet can cause your bowel function to slow after surgery, causing constipation. To help prevent constipation, increase the amount of fluids you drink, especially water. Take an over-the-counter stool softener while on narcotic pain medications. Be sure to follow recommended package instructions. Stop taking stool softeners once your bowel movements return to normal.
Discharge pathway is provided in the Total Joint Book. Daily checklists for the first 2 weeks you are at home include pain and blood clot medication, ice and elevation, constipation prevention, exercises, signs and symptoms of infection, and the orthopedic office phone number. Complete the checklist daily and bring it with you to your 2-week follow-up appointment. There is a provider on call 24 hours a day from the Advanced Center for Orthopedics. They are happy and willing to answer any questions you may have. During office hours, Advanced Center for Orthopedics at 906-225-1321. After office hours, call UP Health System Marquette and ask for the provider on call for Advanced Center for Orthopedics at 906-449-3000. Thank you for attending the virtual Total Joint class. Please remember to fill out the attestation form below and click Submit.